Let's move now to the Western Cape, where hospitals are starting to fill up as the province records over 26,000 active COVID-19 cases. It seems the Western Cape really is firmly in the grip of the third wave, driven, of course, by the Delta variant that has wrought such havoc here in Gauteng. It's predicted the third wave could be as bad as the second for the Western Cape. eNCA reporter Ayesha Ismail has been tracking the story today, and she joins me live from Cape Town. Ayesha, thank you so much for joining us. You know, we saw the new infection rates, the daily toll, 2,820 new cases in the Western Cape just in one day, second only to Gauteng. Those numbers are jumping up really quickly in the Western Cape, it seems. How's the province preparing?
Sally, the Western Cape health authorities have been telling us since the beginning of the resurgence, and this was weeks ago, that they are preparing for the third wave. But here's the thing, their preparations, all their preparations they did around the Alpha and the Beta variants. And now, of course, with Delta being the dominant variant, they have to recalibrate and adapt their preparations, as it were. But they're saying they're keeping a close eye on what's happening in Gauteng, because they do believe that what's happening in Gauteng will spread to the other provinces, and that the Western Cape will mirror what's happening in Gauteng. They're also saying that they are preparing the field hospitals. They've mentioned 3 field hospitals that already have COVID-19 patients in it, and if needs be, there are more beds available. So they are saying that they are ready for the third wave, we are already in the grips of the third wave, and they're expecting the Western Cape to peak towards the end of July and early August.
Gosh, so already pressure on hospitals in the Western Cape. Let's talk about vaccinations in the Western Cape. Hardy's just told us that so far 3.8 million South Africans have received at least 1 dose and a daily jab rate of over 180,000, which is a really encouraging sign. What's the situation in the Western Cape regarding vaccinations?
Well, we heard from the Western Cape's head of health, Dr. Keith Cloete, earlier today that about 500,000 people have already been vaccinated here in the Western Cape. But he's also appealing to people to come forward to be vaccinated, because he's saying it's one thing calling for more vaccines, but you need people to be vaccinated. So the Western Cape is planning, according to Dr. Keith Cloete, to reach herd immunity by November. But he says this can only happen if people come forward to be vaccinated. And Sally, I was vaccinated on Monday. I got my first dose of the Pfizer vaccine. I still haven't grown any horns, and I believe I'm still fully compos mentis. Yes. But I have prepared a package, so let's take a listen to this package.
Western Cape health authorities are keeping a close eye on what is happening in Gauteng. They say this will give them a clear idea of when to expect a peak here, based on the predominant Delta virus.
But be that as it may, our picture points towards the end of July, beginning of August to be a peak. Our current prediction is that the picture will look very similar to what we had at the end of December, beginning of January, which is a strained healthcare system, which is a pressure on especially critical care beds in public and private, and a pressure on people trying to get into hospital, needing oxygen.
Cloete says they are preparing for about 3,000 new infections per day next week and up to 500 daily admissions. He says field hospitals have already been activated and are fully functional, with more beds available if needed. And while the vaccination program is progressing well, with about 500,000 people vaccinated so far, Cloete says community and family infections are driving the increase in numbers. The aim remains to vaccinate as many people as possible, so the province can reach herd immunity by November this year.
We're trying to reach 70% of everybody over the age of 18. We're talking about 3.5 million people. As we've just said, we've got to 500,000. We've got 3 million to go. So those calculations are very simple for us to make, and therefore what we have vaccine supply for. Our aim in this province is to get that done as quickly as feasibly possible.
But Clitty says this all depends on people coming forward to be vaccinated, and those still reluctant to be convinced that the vaccines are safe and can save lives. Ayesha Ismail, Cape Town.